Today's video is a little bit different because I have Kano behind the camera. Kano's wearing pink sneakers, pink t-shirt and a turquoise cap. It's gonna make this video a little bit more exciting than trying to solve the Rubik's Cube. Anyway, aligners, clear aligners, orthodontics, braces, tooth movement, means of moving teeth. I think from a restorative perspective, it's obviously very important because for me personally, I work with teeth that are more often than not either missing or in the wrong place. And we need to find ways or work with our referral group in terms of how to get teeth in the right place so I can replace the missing teeth or enhance the teeth that are in the wrong place. And obviously, I won't say no one, but most patients don't like braces, especially adult patients. They don't like the old railway tracks, and whether we offer them ceramics or the old school silver brackets, everyone wants invisible or minimalistic. And as much as technology has evolved, it doesn't mean that technology always is better or better in every case. So what I'm going to be talking about is a case that came around and from one of the referral guys, and with the main complaint of the patient needing an implant in a gap, and the patient had previously had aligners done. Just for those that don't know what aligners are or the difference between aligners and orthodontics, your advert would probably have looked something like this. Yes, it's a very blurred out, pixelated image, but this is what that cliche is. Braces, aligners, which one do you want to go for? And obviously every patient's going to say they want aligners because it's near invisible, okay? I'm not going to go into the technicalities of aligners and why one is better over the other because I'm not in any position of authority to be commenting on that. Ultimately, from a prosthodontic or a restorative aspect, I just want teeth in the right place that will ensure stability long term so we can ensure some sort of guarantee or healthy long-term prognosis for the teeth. So this is a patient that came around, and as you can see, she's missing a lateral incisor and she needed an implant, or that was what was on the referral note. The patient needs an implant. I think on first glance, it's one of those situations of all that glitters is not gold, because the teeth look what most patients would love. It's clean, it's white, the gums look healthy, so on and so forth, and there's just a gap that obviously needs to be filled. The patient is currently wearing a removable prosthesis, denture, for the missing tooth. But I think the first thing that we need to think about is space. Is there enough space for an implant in that area? And I think it's evident to say that if you look at where the other lateral incisor is, and if you had to try and fit a tooth in that space, it's obviously not going to fit. It's basically just going to overlap and it doesn't work. So we have a space issue, and this patient has already had aligner treatment done, and now there's a space issue. So the first issue that we're going to have here is that the patient needs to be told we need to do either more aligners or more orthodontics. So from an emotive or an expectation perspective, it's difficult because the first challenge now is we need to go back to move forward. Whereas when the patient walks into the practice, she was actually looking forward to this next step of her journey of now no longer having a removable prosthesis, but now having something that is fixed. From a restorative perspective, what am I looking at? And I think I'm not just talking, there's probably going to be clinicians or just the average non-clinician or patient looking at this video. So I'm not going to go too technical, but there's a few technicalities that do need to be respected. And that's from an occlusion perspective. An occlusion is basically the way your upper teeth intercuspate or meet the lower teeth. And there's certain landmarks that need to be respected in different jaw relationships. Not every patient is the same, but there's a few standards that we have to adhere to maintain stability. We don't expect every patient to have this ideal stability or the textbook stability. In the natural occlusion or in a fully dentate patient, it's a lot more forgiving at times because patients will develop into a malocclusion that they may or may not have issues with. But in a restored occlusion or in a restored arch, you need the stability because to protect and to manage forces around the mouth. Nothing is going to be as predictable as having a healthy natural tooth. So once you do a crown or a bridge or an implant or implant bridge, we need to manage the occlusion to ensure that the forces are well balanced. If you look at our image here, to the clinicians, you can obviously see that it's not a molar class 1 relationship, and it's not the ideal canine relationship either, as well as the way the upper teeth intercuspate or meet the lower teeth, it's not a solid closed off bite. That is a problem, not something that that's the focus of the issue right now, but it isn't a problem that we will speak about later on. Looking at the left-hand side, the space is definitely an issue for this implant. There's also a molar up there right at the top that's in the wrong place. Simply put, it's in the wrong place. And there's a gap between the premolar and the molar. So this patient's obviously had an extraction done, and now there's a gap in that area. And the last thing, which obviously comes up in this image, is that on the right-hand side, you can see the top teeth don't touch the bottom teeth, or the bottom teeth don't touch the top teeth. So even though on the previous image we could see the intercuspation was poor, we can see that it's almost non-existent between certain teeth. The other thing that I want to allude to is looking at the arch from the top. It's pretty decent hygiene. However, the top right-hand side molar, there's a filling that's defective. Top left-hand side molar, there's a cavity that's there. These things are important. I think if a patient's going for orthodontic treatment or aligner therapy or any sort of advanced modality to enhance what they have, we need to make sure that the baselines are covered completely. That's the oral hygiene, cavity check, etc., and we can never take that step forward without making sure just the fundamentals are correct. I think what I tell a lot of my patients is you'd rather have a mouthful of your own teeth that are healthy but slightly in the wrong position than having a mouth of perfectly aligned teeth that have cavities in them. And I think that should be the gold standard in all situations. So this is a bit of a technical image, but in essence, these are the three skeletal and dental relationships, or let's call it dental relationships, of how the top jaw meets the bottom jaw. And largely it's based on where the upper molar meets the lower molar and the relationship of those. If you're looking at it in our patient's perspective, there's a problem. We don't have a molar relationship as such, and for those with an orthodontic background, you can see that now there's issues. The canine relationship is equally as important, because the canine, which is your big eye tooth, the 2-3, is what helps guide this lower jaw from left to right. And currently, this canine is biting or it's occluding against the lower first premolar. So these are evident concerns we have from a restorative perspective, and my personal opinion is that nothing can be done without correcting the underlying issue, which is orthodontics in the situation here. Needless to say, we obviously haven't got back to the patient as yet, but needless to say, we engaged with the referral clinician in terms of what was the plan, what was the thinking, what was his opinion on where this case was going. There's always two sides, and I think assessing a case from one perspective, what we see is very easy but also harmful, because there's always background. So after engaging with the referral clinician, what we came about was that this is what the patient initially presented with. Malalignment and crowding and obviously the space, and her main complaint at that time was that she was concerned about the alignment of her teeth, and she merely wanted those teeth to be straightened. And he ventured on to the option of aligner therapy, and he went on and straightened up the teeth. And it was through the journey of aligner therapy, while the patient started seeing this improvement in the position of her teeth, and I think that's what's basically spurred on the motivation for more advanced work, was when at the end she realized, maybe I want an implant. And this is where we are right now. So I think from an expectation perspective, or the initial main complaint, he addressed it and he corrected it. However, now that the expectations have changed, there's a problem. I don't fully agree with that philosophy, because I believe that, and I think this is where Fahim and I also are 100% on the same line, that every treatment plan needs to be based on the ideal. Yes, not every patient can accept the ideal. However, the ideal plan has to always be there, because a deviation from that ideal results in a compromise, obviously. And then when an expectation changes in this situation, your compromise becomes a bigger problem and more finances and biological issues and so on and so forth. And also, I think there's a certain level of professional embarrassment that we don't want to put ourselves under, and that's why we keep it ideal. At times, you could end up losing patients because not all patients subscribe to this, but we can't help it. I think it just helps us sleep better at night. I think in essence, the ideal should have certainly been incorporated here, because we need to remember a dental implant is just a means of retention. My consultant at the university, Dr. Mpongosi, he says there's nothing glorified about an implant over a denture. Both have different means of retention. It's up to what the patient wants or what the patient needs that will choose one over the other. In essence, your proportion and your dental relations in terms of that space of that arch always needs to be adhered to. So this case in essence should have been managed, yes functionally, yes occlusally and aesthetically, because if we looked at the proportions of teeth, the plan, even though correcting the lower arch as well as the issues on the upper arch, should have been, we need space for a lateral incisor of corresponding width and height to match the current one. And this is a catastrophe. I think it's a major catastrophe. It's just very well covered up. And I think the difficult part here is that if you saw a patient that had an implant failed, or failed implant, or a bridge that broke off, it's actually a gory site. There's something that's broken, there's blood, there's infection, these things happen. In this situation, this failure is unseen yet tremendously large in what needs to be done from here, because in essence it needs a full orthodontic workup, and I think a lot more thinking. And I'm not slaying aligners in any means. I'm not slaying fixed braces in any means, or fixed orthodontics in any means. I'm not saying one is better over the other. I think any bit of technology in the wrong hands without the correct insight as when things should be used and how they should be used, you end up with issues that are tragic. And the person that does get the raw end of the deal here is always a patient, unfortunately. So I think that's pretty much my Friday story. A bit of introspection, and one of those bizarre situations of where you look at a failure that looks pretty clean and white, but really does need quite a bit more work and a lot more management from here on in. Is the patient wrong in her expectations changing? Certainly not. I think if the patient didn't want an improvement in her means of retention for her missing tooth, there'd be a problem. We all get cell phone upgrades. People want to wear a new shirt, a new shoe. People want to upgrade themselves. There's no reason why her expectations in terms of her oral health can't be increased. I think it's our responsibility as clinicians to be able to always understand this and respect this, and ensure that whatever plan is given long term is going to be complete and holistic and gives them options in future. That's it. I said I was going to end this 30 seconds ago and I went on a bit longer. But yeah, thanks a lot. Cheers.